So, Assalamu alaikum. Welcome everyone on board. I welcome all of you on behalf of this platform, which is for the guidance of the juniors and the residents, and even at whatever stage of your career you are, uh, for your career progression, and anything we can do for um, for your guidance. Okay. So there are many group of people who will be here, and at the moment there will be some students, there will be some residents, and there may be some of the people who are already established as a clinician. Okay, so this thing just came into into my mind with the thought that I make this forum with the name of make just a second please, make nipping birds blooming flowers. Okay, so the purpose is that who medical students, when they are in the medical school, they should be knowing what what should be their aims and objectives. Okay, because unfortunately when we are in the medical school we don't know what we have to do. Whatever subject we are studying, we only come to know that the anatomy doctor teachers would want you to become an anatomy specialist. The physiology people will want you to be a physiology specialist, and there is not in all the medical colleges where there is the concept of integrated medicine. Okay, because when you will become doctor, the main knowledge or main things will go in the background, and what you need to know or what you need to practice is the integration of all the medical knowledge which you have. Okay, so if you know this thing, that from the very start of your medical school when you are studying, if you have this thing in your mind that you should be correlating the knowledge, the subjects, and make building blocks, so that as soon as you become doctors you have enough knowledge which can make you a good doctor. Okay, so this is one thing you should be knowing. Unfortunately, in medical colleges, there is not much of the information which is being spread. Okay, but the basic purpose for this forum was that I'm able to communicate with the medical students, to communicate with maximum number of medical students across globe, mainly from Pakistan. But I welcome even if there are some people from other country, they can contact me anytime, and I would be very happy to help them out. Okay, so the basic purpose is that you should be integrating your studies. Okay, so you should not try to read anatomy as anatomy and physiology as physiology and pharmacology as pharmacology. You should try to co-integrate. Okay, and for that, if you are, there may be a lot of sources, but actually the Kaplan and the USMLE books. Okay, whether it's not mandatory that at the end of the day you are doing USMLE and you are going to states, but even then, if you are just reading or studying in the way which is there mainly in the USMLE books, actually this will be helping you a lot when you are either going in the clinical exams, like for example later on if you are doing PLAB or Australian Medical Council exam, or press exam for Ireland, and even if you are doing any clinical exam, this will help you. Not only that, if you are in Pakistan and you are only doing the specialization, this FCPS part 1, okay, or you are doing this MSMD program entry exam, or DA, or the diploma exam. So the thing will be that there you can integrate basic sciences with these exams. Okay, and clinical sciences, okay, with this. So step 1 course, if you are preparing, it will not only help you in step 1, it will help you in these exams. Similarly, if you are preparing for step 2, PLAB and AMC and press and step 2, there are so many similarities among them. So my suggestion to you, even Like if you get this message, if you are a first year medical student, I will highly suggest you to, when you go further in your years, try to make building blocks like physiology, anatomy, pathophysiology, pharmacology, medicine. You should just coordinate with reference to systems like CVS, CNS, respiratory system. Okay, so that will help you in great way. So this is one concept which I will highly recommend. There are so many medical colleges in Pakistan, even like Aga Khan, who are having this integrated medical medicine. But not, I'm not sure about the other medical colleges, but in majority of medical colleges, this integrated medicine is gradually infiltrated. So, but this will be of great help to you when you become a doctor and you are already. So this is one component you should be knowing. Other component for our my aim is that I'm coordinating with all the specialities doctors, and I'm trying to make a library of small podcasts and small discussions in which you can peep into the clinical specialities or basic sciences specialty and make up your mind well before you are actually entering the era of house job. Okay, because usually what happens that the people are, they are entering the internship and they don't know what specialty they should be choosing. Okay, what is their temperament, because a lot of things will be depending on their temperament, their family circumstances, their personality, their social and financial, and there are a lot of factors. So if they know the pros and cons and the demands and the scope of that specialty, that will help them become methodical, target oriented, and their progress will be much better than people who don't know. Okay, and they just end up in getting any specialty by chance. Okay, so my suggestion to you, whatever specialty you like, try to have more information. In our platform we will try one by one. I'm trying to gather as many doctors as possible, and I will try to record the introduction of the specialty. I will start from my specialty today at the end of this discussion to give you insight about anesthesia, pain, and ICU, because these specialty actually are under one roof. Yes, they are grown up a lot. So I will give you. I will to start with. I will give you hint about this specialty, and I have got some in people on board who are ready to give their precious time, so that we will make a library of videos, of podcasts, in which uh, all the information about that particular specialty will be there. Okay, and I will be try to just bridge between those specialty doctors and you guys. Okay, so whatever specialty you want to get in knowledge, you can just drop a message to me anytime, and I will try to bring that people on board. Okay, so this is another part of as I sent the introductory message, that this discussion will be to what our aim is with on this platform. So this is helping you in academics. Okay, the other thing is getting information about various specialty. Okay. Then another component is actually a very difficult one, but I'm trying to work on it and trying to get some mechanism by which we are able to help medical students on a whole, and more importantly, the people who want to do the post graduation and they need some help. They are talented, they have the potential, they want to do it, but they are only they are not able to do it because of finances. Okay, it's a difficult job, but what's in my mind that I will try to have fundraising, and then we will try to support the people who really want it. Okay, and there are a lot of platforms with reference to our Lama Iqbal Medical College, AM Kana platform, who are already doing it. but this is they are in US. Okay, we will try to build up a mechanism which is there right in the medical colleges. First of all, I would like any one of you, among the listeners are medical students, please raise the hand. Okay, I will be very happy if you are able to interact with me. Any medical students, and any one of you is medical student? Yes. Ashbala, Usman, welcome. I will be very happy to just have interaction because you are already in this Make Nipping Birds Blooming Flower group. But unfortunately, I am not able to get the response because I am involved in a lot of other activities. So unfortunately, I am not able to do. So making you people as a, like you can say, messenger, I would like you to, first of all, can you unmute your mic? I would like to interact with you. Whosoever wants to speak out, please unmute. Yes.
Assalamu
Okay.
alaikum.
Yes. So first of all, I would like to ask you that what is your perception about this group? I want to know. Be very frank, because I know that people are very busy and they don't are not able to have time to look into it. So first of all, I would like to ask you, what is your perception? What is our aim and
I
objective? What do you think? Yes, Ashbala.
I feel it's a great group और मतलब इसमें अच्छा group है. Basically, my cousin added me in this group क्योंकि like I'm in first year MBBS and he
Very
has
good.
completed his medical.
So, Ashbala,
So
sorry
he
to
told
interrupt
me,
you. Sorry to interrupt you. Actually, you are the one who is my main target, because I
जी,
can change a lot of things in first year MBBS, which unfortunately the people who become in later in their medical schools, unfortunately, maybe a lot of things I will not be able to I will not be able to help in that way, in the way I can do to you. Okay. So first of all, what we should, what you should do, or what we should do, is try to make maximum medical students on board. Okay. I just drop
yes,
a message to me. I will make you admin and try to make sure that all your first year and even the other colleagues of your medical college students are on board. This is one, number one.
okay,
Number two, try to ask question, a lot of question, whatever you want. Even you are studying BD Chorasiya anatomy and you are not understanding anything, just I would be very happy to help you out. Just drop a message in the group. Sir, I'm reading this topic. I don't understand this thing. I will try
okay,
to answer. Number one, then we are trying to get the volunteers among from all the specialities who are able. If I'm not able to answer the question, I will forward that question to the specialty doctor. Okay, and we will try to get the answer. Okay. Uh, this is message number one. Number one. Number two, try to understand what you are becoming. I know that a lot of people will say, medical, why you want to be a doctor? I want to serve the humanity, this and that and that and that. But practically, I will, because I graduated way back in 2004. It's been 20 years now. Okay. And now I can, if I look back, I remember even go back even further when I was in grade 10. And I don't, I try to run away from becoming a doctor. Okay. And my mother, she was really enthusiastic to me make me doctor. Okay. And now in hindsight, unfortunately, she couldn't survive to see me working as a doctor. But now after 20 years, I say that I am proud to be a doctor. Okay, number one. Number two, not because only that it is a speciality which is um, just a second. What is this? Requesting you to start meeting summary. I don't know what is it. I'm sorry. Okay, so first of all, I would like you to understand what you are becoming. Okay, you will be dealing with someone's very dear one. Okay, you will be dealing with someone's mother, someone's father, someone's sister, someone's brother. Okay, so you should have the knowledge by which you are confident that you are in case you need to treat your own mother, you need to treat your own father, you need to treat your own dearest. Yes, of course, it is said that ethically you should not treat your family member, but you should, the concept is that you should have the knowledge that you are confident that you can treat anyone's dearest of family member. Why? Because you are treating someone's mother. You will be treating someone's father. So who are very dear to them, at least. If you are, they are not really your father or your mother, but if you don't learn the things in the way that you would like the other doctor who is treating your family member, unfortunately, this will be not justice to your specialty. Okay. So this is one thing. This is a big, 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 big moral responsibility becoming a doctor. Yes, any other profession, you can say any specialty, any profession needs some care at some point of time. But believe me, this care will be at the maximum when you are talking about a becoming a doctor. Okay. So try to feel this responsibility. So whatever you are studying, try not to read or study only for passing the exam. Yes, passing exam is very important. But if you clear the concept, if you are able to understand that the concept of the knowledge which is required, I think the result will be much better. Exam will, you will believe me, exam will be at the tip of your shoes if you are able to understand the topic. Okay. So please make your intention, you all have to become a doctor who can treat your own mother. Okay, this should be in your mind all the time. Okay, this is one thing. Then of course, as will you will grow in your years, you will have more and more experience, and you will learn a lot of things. Okay, Ashbala. So this is the basic message I want you people to have. And in the group, I will be very happy that you people ask questions. At the moment, what questions we usually get from the people is about the career progression or career prospects in various countries. Okay, so if you ask me, the best place for a doctor to settle down other than their own country, yes, wherever you are, whether you are in some African country or whether you are in Pakistan or whether you are in India or whatever, the best country is yours with so many reasons to stay over there. But if you want to go out of your country, the best country where you can establish yourself in the best possible way is US, because there is no training system comparable to the US training system. There is no system who can accommodate as many international medical graduates as US system. Okay, so a lot of people can debate on it, but in my opinion, the best system for working as a doctor, whether you want to just get your training or you just want to settle over there. Okay, in both cases, the best option is US. Not only because their system is the best, the opportunities are the best, the earning will be the best. So, if any hurdle is there in your way towards US, try to have any agreement so that you are able to cross the hurdles and you are able to go there. So that's my first message. Yes, after that, there will be a lot of, not everyone will be able to go to US. Okay. But if your aim or your study is in that pattern that you are targeting the US system, believe me, all other exams will be piece of cake for you. Okay. As I told you that if you are in medical school class year one, Ashbala, and you are able to study from Kaplan, you are able to study from first aid. After, of course, after you are finishing your topic from the book which you are reading, just as a sweet dish, keep first aid, Kaplan, USMLE World MCQs with you. Okay. And don't at the moment don't think that you have to do USMLE and you have to go to US. Just try to study that pattern. Okay. Believe me, step as I told you, the basic sciences books will help you in any basic sciences exam. Whether later on you become an anesthetist like me and you are appearing in any British exam, you will have no problem because the concepts you will get from the USMLE books, they will help you in anywhere. Then when you become in fourth year, final year, or you are studying the clinical sciences, then the step two books will help you whether later on you want to do PLAB or you want to go to Australia to appear in Australian Medical Council exam. That knowledge will help you. That a lot of there will be a lot of commonalities which will help you uh, pass even PLAB exam later on if you want to change. Okay, so my suggestion to you that keep a pace with the books which are very organized in the form of these Kaplan and first aid and okay. So this is my another suggestion. Yes, integrated medicine. There will be a lot of other sources as well, but this is what is available at the moment, and it is very helpful. Okay, so this is another thing. Then uh, another important component of you being a medical student is your personality buildup, your communication skills. Okay, I don't think so that we don't learn much of communication skills uh, because of the system is not helping us a lot. Our teachers, they are not giving us a very good way of communication skills, but try to learn by whatever way you can. Communication skills are very important. Communication skills will be when you become suddenly you are living in hostel and you have to communicate with your roommate, you have to communicate with your next door neighbors, you have to communicate with all other people. So this will from there you will start how to deal with them politely, how to deal with them in a way that that will build up your personality.
One of my
Okay, and then the
classmates.
same
FCPS, I know this. What is
the
this? FCAIEDAI.
the same thing will go there when you are going to is you are going to the clinical ward, you are dealing with the patients. The same communication skills will help you out. So try to build up a personality in which you are able to send your clear message. Okay, and yeah, this will help you a lot. I will just take a moment for a while, and I would request one of my very closed friend, Najaf, who is joining us from UK. Okay, and Najaf, you can unmute your mic, please.
Hi.
Assalamu alaikum. Yes, Najaf, I would like you because you have joined us. I would be very happy if you say a few words about after MBBS settling down in UK. What will be the pathway? What will, because I will take your separate podcast about your specialty of endocrinology, but since you are here, if you want to speak out few words. Najaf?
Walaikum assalam. Yeah, I can hear you.
Yes.
There may be a bit of a lag in the line. Hello, everyone. So Zishan has just asked me to just say a few words about how to get a medical job in the UK. So there's a lot of competition at the minute, but don't be put off by this because the competition has been created by lots of people from our country and from our neighboring countries coming in to UK to pursue a career in medicine. Obviously, the pathway is to first get GMC registration, and there is no other way other than going through the PLAB exams and then getting the GMC registration. The important thing is to make sure that when you apply for a job, they are looking at two things. One is, do you have any NHS experience or not? Which obviously, if you're coming from abroad, you don't have that. And the other thing they're looking at is, in addition to clinical skills, what other skills are you going to manage at the interview? So the first thing is that while you are here for PLAB exams, please plan ahead and make sure that you can get an attachment, a clinical attachment in any of the hospitals in the UK, in any department in medicine, and make sure that it is at least for 3 to 4 weeks. Because you've already spent money, you've already bought tickets, you're already coming here for the exams anyways. So it doesn't make any sense that you just come in for the academy and the exams and then you leave without having any attachment experience in this country. This will then make a basis of some side of some part of NHS experience, because although it's not a paid experience, you have not worked as a job, but you're still better than someone who, say, for example, has never had any experience working in an NHS environment. The other thing is, while you are doing your attachment, try to do or participate in some sort of a audit or a quality improvement project, or be part of some sort of teaching for the staff in the hospital, because this is another thing which will not only add to your CV, but also be a very valuable answer to a definite question which they're going to ask you in the interview, is about what is your teaching experience? Have you done any audits? Or tell us about any quality improvement project you have done. And because we don't do anything formally like this, unfortunately, back home in our country, it just comes across as quite repetitive when everyone on the interview keeps on saying, we don't have this opportunity in our country, but I'm really interested that when I come to this country, I will try and do something. Because rather than that, if you have done something while you're doing your attachment, you can actually say that although this is not something that is done in Pakistan or India or wherever, however, when I was doing my attachment, I have participated in this audit, and that just stands out. Any questions? I'm happy to take about this topic.
Yes, Najaf, one question I would be asking you, that audits, medical student, what sort of audits they can do? Is there any sort of audit do you think a medical student can do?
So, do you mean that medical students, while they are back in Pakistan?
Yes, yes. When they are like, because a lot of people listening to you is are medical students. Okay, so and because if this question even I am not clear what to tell them. Okay, so like for example, if someone is still in medical school and they want to do some audits or something, what do you think what they can do?
So again, this may come as a surprise to you guys, but most people who are in medical school in this country or in Canada or Australia will be participating in a yearly audit or a quality improvement project. It doesn't have to be something really difficult. It's mostly about whether the published guidance is being followed by the teams or not, and how you can make it better, how can you improve on the practice. So say for example, medical students who are currently working in a medical ward can just look at a few patients who are presenting with an acute attack of asthma and say, okay, we do not have any local guidance in the ward, and every patient with asthma is being managed differently. What does the NICE guidance or the British Thoracic Society or the American guidelines say about an acute attack of asthma? What is the pathway of how they should be managed? Who should be, what is the
Okay.
minimum treatment they should be getting, and then trying to audit that and see whether you are following all these processes, whether the patient was discussed with high care unit or the intensive care unit, if they were deemed appropriate, and then come up with some sort of a plan about how you can improve this in your own department. This is how quality improvement projects and audits work. So you can just do basically in an audit of the clinical practice based on a guidance. That's the simplest form of audit, which doesn't need many days or weeks to complete.
Okay, so Najaf, any audit, any websites where such audit ideas the medical student can extract? Like one of them you have told asthma. Okay, so is there any website where from where they can get some ideas?
So the basic idea is about, if you find anything in your workplace which you think, and you ask the question and say, is there anything we can do to improve this? Is there anything how we can manage this patient better? Is an idea for an audit. And then what the other question is, you have to find a guideline about whether there's a published guidance by a national or international society about how to manage this condition. One of the very unfortunate things back home is that we don't follow or think about improving the patient experience, or making sure that our practice does not differ from one day to the other depending on who is the medical officer or the unit who is doing the emergency management of patients. So if you can look at standardizing some of these management policies, then these constitute as an audit. As an example, if you look at any published journal, there will always be areas where they're publishing abstracts or oral posters, and these can sometimes be very useful ideas about, say for example, if someone is presenting with a diabetic ketoacidosis, what are they doing to improve patient experience and early detection, early treatment. Another
Okay,
example, if lots of people who present with headache, how do you make sure that you're not missing sinister findings. So, say for example, what does the guidance say about who should have a CT scan done and who should be managed by without a scan, or who should have an eye review to look at whether they have papilledema or not. Similar to that is hypertension. Say, for example, anyone presenting with a very high blood pressure, what is the local policy? What is the ward or department policy to manage these patients with a very high blood pressure? How do you differentiate between who gets oral treatment, who goes to IV treatment, who you admit, who you send home? What is the follow-up arrangement for that? And all this, these are multiple ideas which, when you start looking at, you will be surprised at how many things you can actually do. And then you can imagine when someone asks you this question in the interview and you say, I haven't done this, people start thinking, well, it's really not rocket science. You should have thought about this.
Okay, so Najaf, one more question with reference to teaching, because now this is era of multimedia and this is era of using the social media. So, like for example, if one of our colleague, one of the doctor who is right now on board, Rizwan, he is trying to teach whatever he is studying. For example, he is studying pharmacology. He is trying to make some audio notes, and he is trying to spread the message. I have suggested him once to make it on YouTube platform. Okay, so does things like this count when you are appearing in interviews in UK?
Yes, so they accept any form of teaching. The only requirement they have is that it should be of a minimum duration. So, say for example, if you're having one session every 1 week or one session every 2 weeks, that is still appropriate. But then you should have it as a planned activity for at least 2 to 3 months. And
Okay.
the evidence to provide that I have actually done this teaching is in the form of a feedback from the students who have attended the teaching. So, say for example, if someone is trying to present or teach someone PLAB 1 questions or MRCP 1 questions, they can organize something into once a week or twice a week sort of session, but then run it for at least 2 to 3 months, and then get a
Okay,
formal feedback in paper form from the
I
people
understand.
who have been taught to show that this was a useful session or not.
Okay. Okay. So Rizwan, I hope you got this message, because you are doing a wonderful job, and now you have listened from one of my very one of the doctor who is working in UK, that the thing which you are doing, if you just organize it in a better way, you can get even a lot of benefit. Okay. So this is a message for you. I hope, Rizwan Dhandla, you are listening to the message. Okay. So I now thanks a lot, Najaf. I will take your time for formally recording discussion about your field of endocrinology. And I heard you whispering that what is this FCAI and what is this and this and that. So I would like to tell you that FCI is Fellow College of Anesthetists Ireland, and EDAIC is European Diploma in Anesthesia and ICU, and your EDRA is European Diploma in Regional Anesthesia, and FDRA is a French Diploma in Regional Anesthesia. Okay, so I would
I
I
was just joking with one of my friends
no problem, no
about your
problem.
qualifications. It
But
was
but I'm just trying to tell you that when you left me, I was not that much knowledgeable, and I still owe the discussion done with you in first professional exam of physiology. Najaf is my buddy. Najaf, we used to be live together, and it's very nice to see him after a long time, because unfortunately with the challenges of life, you get away, but whenever you listen to your friends, you feel as if you are again in that then the same time. Okay, so I thanks to now I will take opportunity from another person who is also a gem of a person, Bilal Tufel. Can you speak out something? Bilal Tufel is a very talented doctor. He's anesthetist, okay, and he can tell you few words about another pathway for the people who did their post graduation in Pakistan, okay, and then they did USMLE, and then they get the fellowship in US, and they are able to enter in the US system, because there is a misconcept that if you don't do USMLE after graduation, then you can never get into the system of US. Okay, so Bilal, thanks a lot for joining, and I would like you to speak few words, because I will take a detailed discussion with you later on. But I'm just because I will be signing off after few minutes to have some words about anesthesia and a few words about the rest of the things which we are trying to do in our this blooming make nipping birds blooming flower platform. So few words about your experience and your pathway from FCPS journey to now working as a fellow in US.
Yes. So, good day to everyone. My name is Bilal. I'm working as an advanced airway slash oral anesthesiology at Bronx in the New York. And regarding the journey of this track is though hard, but it's never too late. So here in the US, especially after the COVID, the job market the specialty of anesthesiology is super hard. So issue is that there are a lot of supra specialty training like airway, regional, acute pain, cardiothoracic, obs anesthesia, and a lot of those slots remain unfilled. The reason is that their own trainees are not in the favor of going into the training for another year because they have a lot of backup of loans, and they have other responsibilities, and they have a very long journey till they are finishing their residency and they are board eligible and they are about to finish their oral boards like we do as a FCPS Viva exams. So those slots are unfilled. So issue is that here people are ready to take those candidates who have a extensive training program in the anesthesiology back home, and they just need to have some legal requirement like you must have your all three steps done, and you must have a good person here who can speak on your behalf, or you just keep going in and out on different conferences, meet program directors, and it's hard to come in. But once you are in, then even people do reverse program here. Like when I came in as a fellow, after 8 to 10 weeks, people start talking to me that what are your plan, you're gonna stay here. Even some people were pushing for the residency interviews also. So there are a lot of people who come as a fellow here after FCPS, or they come from India as finishing their MD programs, and they just do supra specialty first like I am doing, and some of them get a alternate pathway. They get a faculty seat and they stay in the department for 4 years, and then department writes a letter to ABA that this person don't need any more training and he is eligible to sit in the final exam. This is one track. Other track is that they do a year or 2 year fellowship and they get match in the same program or some other programs. But to get into residency for an old grad is tough. So this is a feasible opportunity, and if you compare this track to the people who are going to Europe, UK, Ireland, I think this track is much more better, because once you are in a position to work as an attending, money wise you are in a better position, because a lot of people who are working in UK or Ireland, they are they due to some reasons they have to go back to Middle East to earn some money, because they are not very highly paid as an attending in the UK or Ireland, and that's the one of the reason. And I guess that still few people are here in the system via the track which I opted to come in, because people don't want to do work hard one more time, because when you start doing USMLE you have to start from the scratch, like basics and clinical and then step 3. Though this pathway is hard, but the outcome is really great. And as I'm already in the system, so I'm in touch with Dr. Zishan and few senior who really helped me to learn about anesthesiology when I was at my basics of training. So if someone is there who is interested in the pathway, we can help him to bring him into the track. And if Zishan, Dr. Zishan want to do a different session on this topic, I can do my homework and I can come up with the better statistics and
Yes,
to give a
yes,
better idea
Bilal,
about it.
because I just caught you for a few minutes so that we can just give you a taste to the people. And believe me, one thing, Bilal or anyone can help you only when you finish USMLE, okay? Because there are so many people who will ask his number. I will not give his number to anyone unless you have finished USMLE, because I know that he can help only once you finish USMLE. Before USMLE, even I was twisted. Najaf is still here. Yeah, Najaf, my ears was twisted by Mamuna Mia. Okay, so once I was very enthusiastic about USMLE, and I had a discussion, the first question by her was, have you done how much are your score in USMLE? And I said, I am only thinking about USMLE. And she said, once you have not done anything and you are eating my brain, so finish USMLE and then talk to me. And unfortunately, because of many reasons, I couldn't do it. But I it's still at age of 44. Believe me, it's in my mind that inshallah, if Allah give me some way, I will do it. Because not because life is was for once. I'm not saying it's not matter of money even. Remember one thing, if you are in the world, try to do the best. Okay. So, in my opinion, maybe Najaf will disagree because he's working in UK. But in many aspects, if you compare US from any other country, there is no comparison. The level of the
No,
work they are doing, the
I
earnings they are
want to
getting.
add that we cannot blame or we cannot under grade other country system. Every country got its own benefits and disadvantages. But Dr. Zichan is right. Even here, people don't take you seriously. I'm talking about Americans. If you don't have everything in your hand, because people are super busy over here, they don't want to waste their time even on the interviews. But believe me, there are a lot of spots who remain unfilled. Even the center where I am working, they were happy to take me a fellow in any subspecialty which I want to do, like neuroanesthesia PD was asking me, cardiothoracic PD was asking me, if you want to do it, we can take you in, because they know me now. They have an idea of my capabilities over here, and they really need the well-trained people who can sit in the OR on their behalf so that they can do their academic work like interviews or some departmental meetings, but they really train you well. So, but it's not, like that they will take everyone. They will preferably keep slots empty if they don't get appropriate candidates for that. But again, word of mouth works in this country, like that. If you are known to someone and he speaks on your behalf, so it's more easier to get in.
But we you say in even in Saudi Arabia, Vasta. So Vasta is there, everyone, but you can only have Vasta
Yeah,
if you really deserve. Vasta can be only to introduce yourself, but after that, you will be the one who will be facing the music. If you are not capable,
yeah,
even no Vasta can help you. Am I right, Bilal?
yes, you're right. And here a lot of people who do residency, like I have seen an old grad who was in who finished his medical school back home in 1984, and he was IM resident here. So I see old grad who graduated in 1997, and she is a psychiatry resident over here. So it's never too late, but it's all about when you start. And you will meet 90 people who will say you cannot come in, but you have to say that if there is 0.1% chance, I'm gonna try for that. So here Americans like those people who want to do something out of the box. So it's not a very big rocket science, and I was not a very good student. My past is so bad. I had in all professionals, I used to appear in supplementary exams. So your all academic, you know, count after your graduation, when you start your work, your skills. If you have some research work, is going to help you out. And on top of that, it depends on you how you're going to sell yourself in the interviews.
Okay, thanks, Bilal.
Yeah. All right.
Thanks a lot. And now I will just tell that our aim is to make a platform in which we will be able to have some fundraising for the medical students, or even the people who are appearing in the any national or international exams, and they are having restrictions because of financial constraint. I know this is a big journey. I don't have any clear plan about how I will be able to do it, but this is in our mind. Okay, so
Of course,
Ashbala,
we're gonna help the people back home. We're gonna we. I am the one who really need few of the top ranked graduates from my country who come over here, and financial challenges, we can help them out. So, but they have to read, they have to work hard, they have to finish their exams. So I am into for this great job. No
okay,
issues.
okay, thanks a lot. Okay, so
Ah,
as I promised that today our aim, before I go, because I'm thinking that I will also introduce my specialty in the separate discussion. So before we any question from any one of you, anyone wants to ask any question, please. Ashbala, you are our. There were some more hands raised. I think some of them are already left. Sajjal, you had raised the hand. You want to ask something, please? I I saw your hand raised before. Any questions, please? Ashbala, would you like to say something? Yes. If Ashbala, you don't have question, Rizwan, can you speak out something, because you are doing something great. And I would, as I suggested it to you when I called you, I would like you to have some words about, and you can tell the people what you are doing. Yes, Rizwan.
जी सर, मैं उर्दू में ही स्पीक करूँगा, इंग्लिश मेरी उतनी अच्छी नहीं है अभी। सर फार्मली तो मैंने वो पहले फार्माकोलॉजी का किया था, उसको मैंने अभी स्टॉप कर दिया। उसके बाद अभी जो मेरा प्रोजेक्ट है वो है अनाटमी का, स्पेशली जो सेकंड ईयर के स्टूडेंट हैं उनके लिए
Okay.
मैंने ये स्टार्ट किया है। लेकिन इसमें
Okay.
जो मुझे एक बहुत अच्छा पॉइंट मिला है कि मैं उसको रिकॉर्ड पे भी लेके आऊँ। इस वक्त कोई मेरे
Yes.
पास 2000 प्लस स्टूडेंट्स हैं जो कि यानी
Yes.
अनाटमी
If
पढ़
you
रहे हैं
if you
मुझसे,
remember, I asked
इंटरनेशनल भी
you.
है, नेशनल।
He's saying that because he started with pharmacology and then he started with anatomy. You are in third year. You are in second year. Am I right?
नहीं सर, हम थर्ड ईयर हैं।
You are in third year. So he is
आई
in
एम
third year
इन
medical school. He tried to teach he tried to make audio notes about whatever he is studying, and this is a good suggestion to all medical students. Try to speak out whatever you are studying. Only one thing I will suggest to you: try to make it in video, or if you are reluctant to have in video, try to make it in screen sharing, because this will have a better effect rather than only audio. Okay, so my suggestion to you, as I requested you when I called you, try to make the notes in audio screen sharing. You can do it in the laptop. You can do it in even smartphone. There is an option of screen recording. And if you record up to 2.5 minutes, 2 minutes and 30 seconds, you can even share without putting on YouTube. If your recording is more than that, then you can upload in YouTube. Like I do. Whatever I do, I record it in YouTube and I put it, I record in my laptop or mobile and I put on YouTube. Okay. Because if you will go, because not everyone would like to have it as a commercial. Like I don't do it for any financial purpose. Okay. So if you don't have any aim like that, even if you are doing it only for yourself, or you want to do it as a teaching purpose, as Najaf also told, and also Bilal, that the such things can add to your CV. The one thing even I'm not doing, that is the feedback. I'm not sure. I will ask him how to make how I can do, because I have done a lot of sessions. on my specialty and all other specialities, uh, which I have not taken any feedback or things like that. But it's a good idea for me as well, as that maybe at some point of time I can utilize this thing. Okay, so any other question from any one of you?
जी सर
Yes.
नजब से थोड़ा सा ये भी यानी डिटेल लें कि हम ये जो इसको रिकॉर्ड किस तरह से करें, जो वो रिकॉर्ड आगे जाके हमारे काम भी आए, क्योंकि स्टूडेंट तो आ रहे होते हैं, जा रहे होते हैं इस तरह से,
No.
thousands
I
of
will tell
students
you.
left.
I will tell you. There is a Google form. Okay. So whosoever coming to you, you will just make a
Yes.
Google form. In the Google form, you will take the feedback that the recording which you did on that topic. There is a Google form.
Yes.
You like you can just make a Google form format, and then whenever you are sharing something, you have to say that you have to fill a feedback form. Okay, so in that
Okay.
Google form, when whosoever will fill, it will come to you as a record, and then you can make it in Excel file. I have never done it, but I know that's how it works. Okay.
Okay. Yes, sir. Thank you.
Okay. So I think I will finish at the moment, because I was thinking to tell about anesthesia specialty, but I will I will summarize that our this make nipping birds blooming flower is the concept for not only for medical students, for residents, and even people at whatever stage of their career they are. Okay, if anything we can do to help them out, to guide them for a better future, we are there to help you out. Okay, in whatever way, whether these are academics, whether they are sharing the opportunities. I'm trying to gather all the information from not only from UK, from Ireland, from US, and just trying to with the same perspective. I have done a lot of career counseling sessions, because not much of information is there to the people. Okay, so my request will be to spread the message to maximum number of people, and we will keep on recording. My next aim will be to record informative, concise discussion with all the specialities, whether it is subspecialties of medicine. Like one of our class fellow, our friend is in rehabilitative medicine. Not people don't know much about it. Like Najaf is a endocrinologist. There are so many other specialties, intervention. One of my friend, he is interventional nephrologist. Very few people know about it. Even I used to ask him, what is this specialty? So we will just try to have information, okay, so that we make you people a better doctor than us. Okay, so thanks a lot, all of you. Special thanks to Najaf and Bilal, and all other participants who tolerated us for this time. And you all are welcome. Join our hands, because my aim is to give back to my country whatever Allah has bestowed on me upon me. Thank you very much. And I saw some of the questions over here. Can we get electives opportunities from your side after MLE? This is a long journey. Uh, Unfortunately, I don't have, I have few contacts, but I will try to have some information about how to get electives. Can we get elective from your side after? I want to ask you guys about research. It's especially hard to find mentors. One of our doctor, unfortunately today she is not available. Dr. Afshan Khatak. She is American diplomat in pediatrics. She is also there in our group. She's she's our main mentor, and she has a lot of experience in research. So all of you are welcome to contact her. I can share, after you in the link which I shared, my number is there. So any one of you can contact me via WhatsApp, and I will add it to that group, and inshallah we can uh, have further. There was some question from first year, where most has complete idea available for them, but the only thing which is main hindrance is finances. If you get help from some association, we will do. That's what we are trying to do. Remember one thing: no, not much of the finances are required for studies. Okay, for if you want to study only, and you don't need, they will not take money from you if you are studying from Kaplan when you are in first year MBBS. Okay, so keep yourself ready like a horse of a marathon race. Okay, for marathon race you need your muscle to develop the strength to run for marathon. Not everyone can run a marathon race, am I right? So prepare yourself for a marathon race, and when that stage will come, Allah will make some of the way for that. But for the first thing is our studies. If you don't study, if you don't work hard, as Bilal mentioned, that there are fair chances, even in US, even in UK. Yes, the things are getting tight anywhere. Okay, but if you are, don't look at the losers. Don't look at the losers, because losers will drag you towards loss. Okay, look at the people who won the race, and try to be with them. Okay, because a lot of
ये
things are.
ये जिशान, मैं आपकी इस बात से बिल्कुल एग्री करूंगा कि
Yes.
आजकल जितनी भी न्यूज़ लोगों से आप सुनते हैं, जितने भी लोग बाहर से, यूरोप वाली साइड से, यूके वाली साइड से, आयरलैंड से होके आते हैं, वो सब के सब ये बात करते हैं कि कंपटीशन बहुत ज़्यादा है। लेकिन अभी भी याद रखें कि कंपटीशन उस तरह से नहीं है जैसा 2004 2005 में शुरू हो गया था, जब यूरोपियंस माइग्रेट करके यूके में आ रहे थे, और इट वाज वन कॉमन एरिया जहां पर हर किसी को बगैर किसी रीजन के, बगैर एक दूसरे की क्वालिफिकेशंस को जज किए सबको जॉब्स मिल रही थी। देयर आर लॉट्स ऑफ जॉब्स इन यूके, लॉट्स ऑफ ट्रेनिंग अपॉर्चुनिटीज। बात सिर्फ वही है कि यू हैव टू हैव ए वेरी गुड CV एंड ए वेरी गुड इंटरव्यू टू एक्चुअली लैंड द जॉब। और एक बार जब फिर जॉब करके किसी भी तरह से घुस गए अंदर, देन इन कंट्रीज की सबसे अच्छी बात ये होती है कि वंस यू आर इन ए प्लेस विद a ट्रेनिंग प्रोग्राम, ये उनकी रिस्पॉन्सिबिलिटी है कि दे विल कुक यू एंड दे विल मेक श्योर दैट यू कम आउट एज अ कंसल्टेंट।
Yes. Okay, so you can find a special of our internet while to go the training under CIP. VHU experience is exceptional case. Umair, this is with reference to the training in Pakistan. I don't have much idea, but of course, whatever they want you to do, you should do. You should have some basic health unit experience if you want to pursue your career in Pakistan. You will have to do it. Okay. And there was any other question which I missed. Please, if I missed anything, please just drop a message to me, and I will try to answer. Okay. So I will just stop here. There are a lot of discussion which I have done already, and you can just find a lot of data which I have already recorded on board in my YouTube channel. This is you will go to this anesthesia knowledge channel, and then you will find a playlist of career counseling. Just let me show you. I shared this career counseling playlist a number of time. I don't know where it has gone. It's here, right here. So you can just find a lot of discussions which I have done before. Yes, it's right here. Okay. So with not only with reference to the our make nipping birds blooming flower, this was discussion on 9th of March. Unfortunately, I couldn't do it after because Ramadan, I was busy. And a lot of this information about training system in UK, problems in Saudi Arabia, Gulf countries. I have done whatever I could, I have done. And here I will put the information about all the specialties. Okay. So I will just try to make a platform where you can get any information. Okay. So all of you are welcome to ask anything anytime. Okay. So I will stop here, and thanks a lot for your time.
सर अपने चैनल का नाम तो बताएं।
I'm sorry.
सर आपके चैनल का नाम क्या है?
Anesthesia knowledge. It's right there in the link even I shared to you. This is the channel. This is the channel. Okay, this is the channel anesthesia knowledge. Okay. And by the way, this is not a monetized channel. So don't think that I'm doing I'm not doing it for publicity for my channel. Okay. This is for all of you. Mainly it was for anesthesia. Then I started something about this career counseling. I'm trying to learn Quran as well. Then I make it separately. Some of the videos are here right now. So a lot of things I'm trying to do. Okay. So thanks a lot, all of you, my dear. Inshallah, we will meet again. A special thanks to Bilal and Najaf again before I sign off. Bye bye. Assalamu alaikum.